as it says in the program, I'm serving on the, I served on the Global Commission on HIV and the Law, and also on the so-called Eminent Persons Group of the Commonwealth of Nations, which was concerned with the future of the Commonwealth. Strangely enough, that became very involved in the AIDS epidemic, because the AIDS epidemic is twice as prevalent in Commonwealth countries as it is in non-Commonwealth countries. And there's a reason for that, which the Eminent Persons Group detected. And the reason is that in Commonwealth countries, they are the beneficiaries of many wonderful blessings of British rule, but one of the most unfortunate of the consequences of British rule is that they left everywhere that they ruled with the law criminalising homosexuals and criminalising sex workers. The British had a big thing about sex, and therefore they enacted laws which which are very relevant to the vectors by which the virus is spread. The virus is mainly spread by heterosexual, adult, consensual sexual conduct, mainly in marriages, but substantially through commercial sex workers. Also in Africa, about 11% through gays, and throughout the world, significant other forms of sexual congress that spread the virus. But as well as that, mother to child, and also injecting drug use. Weren't we lucky in Australia when HIV came along that we had Neil Blewett as the health minister and Peter Boehm as the shadow health minister? Neil Blewett, who we now know as a gay man, and Peter Boehm, the shadow health minister, who was a professor of public health. They agreed that we would adopt needle exchange. And you can go to pharmacists right across Australia and get a clean needle for a used one. And the consequence of that is that our level of HIV transmission is about 2%. 2% of injectors have seroconverted and are HIV positive. In New Zealand, which got there first, we copied them, it's 1%. In Canada, where it's only available in BC, it's 18% Canada-wide. In the United States, it's 33%. 33% of injectors are HIV positive. A very efficient way to spread it through the general population. And in Russia and Thailand, it's 50%. So it's really, we have been saved. We saved not only lots of money and budget money, but we saved human lives and suffering and expense and medical risk. How you respond to the epidemic is really important. And the Commonwealth Eminent Persons Group recommended that the Commonwealth take steps and that there be leadership in Asian and African countries of the Commonwealth to get rid of these laws. And that was adopted by the 10 members of the group. Naturally, I was pressing this both because of my sexual orientation, but also because of my experience with HIV. And the group was chaired by Tun Abdullah Badawi, the past Prime Minister of Malaysia, an Islamic scholar. But he and the other Islamic member of the group agreed with this. We've just got to look at life first, and we've got to save lives and get this done. Now, and another group that I served on until last year was called the Global Commission on HIV and the Law. This was set up by Helen Clark for the purpose of UNDP, the United Nations Development Programme, looking at those areas where the law was a positive impediment to these strategies against HIV. And naturally enough, it came up with the conclusion we've got to get rid of some of these laws relating to sex workers, drug users, and gays, and try to make the law a help in the AIDS epidemic and not a hindrance. That took us in that commission into intellectual property, because intellectual property law is relevant to the availability of the antiretroviral drugs, which make such an amazing difference to people who are living with HIV. And the position is this, that at the moment there are 33 million people living with HIV. There are 10 million people who've already got on to the antiretrovirals. There are probably another 5 million who need the antiretrovirals in the here and now. Even the 10 million in 10 years is amazing development. I saw an email this morning saying that yesterday the US Congress signed off on their subvention for this year, which is 1.2 billion US dollars. It's really an amazing thing. Don't you think that in the midst of their economic problems, they're continuing probably the best thing George W. Bush did, which was to make the funds available for the Global Fund and for the PEPFAR, the President's Emergency Fund, to respond to this global crisis and problem. But we're getting to a point where the early retrovirals, which were often based upon drugs which were able to be copied in generics, they are beginning to show side effects. And so there's a need to upgrade to the so-called second line and third line therapies of the antiretroviral drugs. And they are not available in generics. They can't just be manufactured in India and Brazil and given at very cheap cost to the developing countries. So we've got a big problem now, and the Global Commission recommended that the UN should take a strategy to try to make a new international regime for intellectual property law, which would have a differential regime for developed countries and developing countries, so that it wouldn't depend on where you were born or where you were living as to whether you got access to the best available healthcare. In the Universal Declaration of Human Rights and in the International Covenant on Economic, Social and Cultural Rights, they both recognise the two competing laws here. On the one hand, they recognise the right of inventors to have protection for their inventions, but they also recognise the right of everyone to have available the best available healthcare. So how you reconcile those two is the big challenge which the UN faces at the moment, and that was opened up in the report of the Global Commission on HIV and the Law.